rotate your phone. Facebook is telling me to rotate my phone again. So hopefully I am right side up and I don't see, oh, I see people coming on now. So let me know if I'm right side up. This is your host, Dr. Polly Heil-Mealey with Abundant Health and Wellness, and we are your holistic healthcare clinic in downtown Humble, Main Street, and Avenue C. So, says no, don't do it. Don't do what? Am I upside down again? Please tell me I'm not upside down. Okay. Y'all tell me if I'm upside down. I look right side up, but Facebook told me to rotate a while ago. So hopefully I'm not spinning as we did last week. So last week we began a series on the immune system, and we're talking about the innate immune system, and then we're talking about the acquired immune system, and then we're going to go into autoimmunity. And so it's very, very complicated. So just want to remind you that the innate immune system is your immune system that you are born with. We talked about that last week. If you want to go back and review that video, that would be great. Today, what we're going to be talking about and leading into autoimmune disorder is the acquired immune system. Now, your immune system that you are born with, right, is something that hopefully everybody got, good genes and that kind of thing. But acquired immunity are the things that we become active to or aware of that are dangers in the atmosphere. So that would be germs, that would be dirt, that would be viruses, that would be parasites, that would be anything like that that is something that we actually come into contact with in our living. And so basically, if you could see my desk, I have papers all over my desk, so it's a little bit confusing here. So I'm trying to find a train of thought that everybody can kind of work into, and let me know if you're having a question. So I'm seeing a lot of comments there, so thank you so much for joining us. So the main part of your acquired immune system is your lymphatic system. Now, some of you may not know what a lymphatic system is, but a lymphatic system is your second circulatory system. Your main circulatory system is your bloodstream. You have a heart that pumps blood to all of your body. Your second circulatory system is your lymphatic system. Now, you may know, if you've lived long enough, that you've had a blister, right? Well, that clear fluid inside of the blister is your lymphatic fluid. If you've had a strawberry on your knee, you've fallen down, you've ridden your bike, you've got road rash or whatever, and you get this white pussy stuff, that is your lymphatic fluid. So that is one of your main guardians at the gate for your immune system. That is your acquired immune system. So lymph, you've got 40 pints of lymphatic fluid in your body. Okay, so that's quite a bit more than the blood supply that you have. And so the lymphatic system, I call it the vacuum cleaner of your body. If you're not disposing of the waste appropriately, then you're going to have a backed up system. So just like at home, when you're running your vacuum cleaner and you hear that dreaded sound, and you maybe smell something because something's gotten stuck in the vacuum cleaner, you've got to take it apart, you've got to take care of it. Well, the same thing with your lymphatic. Now, most of you know that you've got lymph nodes right here under your jaw and your neck. You've got them underneath your armpits in the axilla. You've got them all the way down your spinal cord. You've got them in the groin, and you've got them behind your knees. So you've got lymph nodes that connect all of these lymphatic vessels in the body so that they can do the housekeeping to keep the body healthy. Now, this is a fact that you may or may not know, if you took all of the lymphatic vessels in your body and you laid them end to end, and you took all of the rivers in the world and you laid them end to end, your lymphatic vessels would be longer than all the rivers in the world. So God has truly made us amazing, and we want to keep the lymphatic system working the way it needs to, because the lymphatic system has all the good guys in it to keep our body healthy. So what does that mean practically? Well, the lymph cleans up all the cells, dumps all the toxic waste into the liver. The liver filters everything, filters the blood, dumps all that toxic waste into the large intestine. The large intestine takes all the toxic waste out of the body. So if you're not moving your bowels 2 to 3 times a day, every day, if you're not detoxifying the liver at least once a year, if you're over the age of 50, then your lymphatic system is going to come under attack and it's not going to work the way it needs to. So let's just kind of look at what it does. So the lymphatic flows from the interstitial fluid through the lymphatic vessels up either through the thoracic duct or the right lymph duct, which terminates in the subclavian veins. And I know y'all are just hearing, rah, 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 rah. So what I want to say is that every cell in your body, the lymphatic fluid goes through that, picks up all the dirt, goes through the lymph nodes, wherever they may be, whether it's in your neck or your axilla or your spine or wherever. You've got those macrophages that we talked about last week, the phagocytes that we talked about last week. They're chomping away, eating up all the debris. So once all of that happens, that lymphatic fluid passes through the nodes, keeps going where it's going, into the liver, drops off all of its toxic waste. The liver goes into the bowel takes it out of the body. So your primary organs in your lymphatic system are your bone marrow, your thymus, and your spleen. So a lot of times you'll hear about people who have had an accident and they've had their spleen removed, or they've had their spleen rupture. Now this is a big deal on your immune system, because if you don't have a spleen, then you're not going to be doing or making some components to your immune system, which is what you need to do. So about 2/3 of all the lymph nodes and lymphatic tissue are located near or within the GI tract. So this is why what you're eating is very important, because if you're eating toxic chemicals, if you're eating processed food, if you're eating genetically modified organisms, then all of that toxicity is going to go right into those lymphatic vessels, which is going to clog them up, and it's going to hamper your immunity. So I just kind of want to throw that out there. I know I'm not the food Nazi. I don't want to be the food Nazi. Okay, so it's just something that we need to kind of work with. So the lymphatic system is closely related to the circulatory system. So you need to understand that. The lymphatic system helps defend the body against invasion by disease-causing agents such as viruses, bacteria, fungi, okay? So these are all the things that we come in contact with that our body has to mount an immune response. So here we are in 2018, and we're hyper vigilant and we're hyper clean, and we have hand sanitizer everywhere, and we're very aware of germs, and that's a good thing. But if you're never exposed to a germ, then the body doesn't have an ability to get what it needs as far as recognizing things that are out there in the world that have come into the body that it needs to mount an immune response again. So I will just tell you, my mother tells me that as a child, I used to eat out of the dog dish. Who knew? Okay, my dog was my best friend, and I guess I thought if the food was good for her, it would be good for me. Obviously, it was full of pathogens. It was not fit for human consumption, because this was in the 1960s, and who knows what all was in that dog food. But she likes to tell the story that I would get down on my hands and knees with our little baby puppy, and I would drink the water and eat the food that the puppy did. Now, of course, she cautioned me not to, and I probably was very obedient. But that kind of exposure gives your body, hey, this is coming in. This is not something I recognize. This is something I need to come against. I need to mount an immune response against that. This is how we get acquired immunity, okay? So it's kind of interesting. The spleen plays an important part of a person's immune system. It helps the body fight infection. Just like the lymph nodes, the spleen contains antibody-producing lymphocytes. These antibodies weaken and kill bacteria, viruses, and other organisms that cause infection, okay? Also, if the blood is passing through the spleen and it carries damaged cells, then the white blood cells called macrophages in the spleen will destroy them and clear them from the bloodstream. So as you can see, if you don't have a spleen, then you're at a disadvantage. And if your spleen's not working properly, then you're at a disadvantage. But do not fear, because we've got a product that actually helps rebuild all of that. So this is kind of a cool thing. And I want to talk about, yes. Okay, so in your acquired immunity, you've got the lymphocytes. You've got your B cells and your T cells, okay? I'm not going to go into all of this because you're going to just hear Charlie Brown's teacher, and I don't want to be that person. What you need to know is your body knows how to do what it needs to do if it's not overcome by other environmental toxins, okay? So your B cells and your T cells must work together to be effective. Now, sometimes they don't work together, and this is when we get the beginnings of an autoimmune disease. And I'm just going to tell you that the beginning of an autoimmune disease is an allergy response, okay? The body is not supposed to be allergic to things. When the body mounts an allergy response, the body is telling you, I have too many toxic things in the body. This one more thing, whether it's a plant, a spore, a pollen, whatever, or maybe it's food. We've talked about leaky gut syndrome and that kind of thing. It may be food. And so all of those kind of things can tip the balance and cause the immune system to go, hey, I can't take anymore. I'm going to mount this allergic response. That is really an indicator that we need to be very, very concerned about what's going on in our immune system, because when the body gets to that tipping point, it ceases to understand what is self and what is non-self. So self, remember we talked last week about the biomarkers, that everything that is supposed to be in the body has this biomarker. It's a histamine, I can't remember what it was called, but a histamine something complex. Anything that's not self does not have that marker, so the body goes after that. If there are too many of those kind of things, then the body just kind of spazzes and says, I can't do anything about it. I'm just going to start attacking everything, which leads us into autoimmune conditions, okay? So hope that is clear. Now, in the body, we've got dendrite cells. Okay, you're going to have to Google that and look that up because I don't have enough time to go into a biology lesson, okay? But you've got these dendritic cells, and they're covered with a maze of membrane processes that look just like the nerve cell dendrites. So you've got these dendritic cells. They look like dendrites. Most of them are very, very efficient at antigen presenting. They find the antigen. Remember, the antigen is something that the body makes to come against something that's infecting the body. So these cells, these dendritic cells, make it a point of attracting the antigen and efficiently presenting it to a T helper cell and activating the macrophages and the phagocytes to take care of that. So that's really, really important to know. The body knows what to do. So each of the cells in the innate immune system, that's what we're born with. This is particularly in your kidneys, okay? So just as a sidebar, your kidneys start to enter into the aging process when you become 30 years of age, right? So we have to make sure that our kidneys are functioning well into old age so that those cells, right, these innate cells have the ability to catch all of the dendritic, they do what they do. So each of these cells, they're mainly in the innate immune system in the kidney, bind to the antigen using a pattern recognition receptor, PRP. Write that down. Pattern recognition receptor. So the body says, this is an antigen. I need you to take care of this. And it goes through those dendritic cells. They get the B cells, the T cells. They engulf it. They eat it up. They take care of it. And we are good to go. Okay, we're winning this war, right? So mercury, now we all know what mercury is, right? Used to be in the thermometers. And now we don't have mercury in the thermometers anymore. And I've talked to people that are my age, and we've all of us that I have talked to, we've accidentally broken a thermometer. We've seen the mercury ball up. We've played with it, of course, no gloves or whatever. And so we've been exposed to mercury. Mercury is also in our vaccines, okay? So this is a kind of a big deal because everybody's pushing for people to get the vaccine. So this is what you need to know about that. Mercury destroys the dendritic cells, okay? It keeps the PRP from recognizing the pathogens, okay? So it is the start of the autoimmune disorder. So let me just say that again. In your innate immune system, that is what you're born with. These particular cells are mainly located in the kidneys. They are supposed to use pattern recognition receptors to find non-self. When we have mercury poisoning, when we have heavy metal poisoning, then that mercury kills the dendritic cells, so the immune system is not able to recognize that pattern recognition receptor. So this is a huge, huge thing. So what can you do? Well, there are a lot of things that you can do. Hopefully, those of you that have already autoimmune disorders, just be encouraged. We work with this all the time in the clinic, and we're able to get the body where it needs to be so that it is not confused anymore. When the body is not confused, it quits attacking the self. Okay, but it's not something that happens overnight. It's not something that happens maybe in 30 days. It could take 3 to 9 months in order for this to happen. And you've got to be mindful of what you're doing. You've got to be mindful of what you're bringing into the body. So people will ask us, how do we get heavy metal toxicity? Well, one way that we get it is through our vaccinations. One way we get it is through all the processed foods, because the processed foods are contaminated. One way we get it is with the genetically modified foods. Now, if you've not been following that, you really need to look at some things, because genetically modified foods introduce heavy metals into the body. Heavy metal toxicity is a big, big thing, and it weakens the immune system. It also causes some mental issues, dementia, Alzheimer's, Parkinson's, all that kind of stuff. So we don't want to have that. So we need to make sure that our pattern receptor recognitions, that they are working, and they are working at a good thing. So one of the things that I look for when I'm working with you is I'm looking at your kidney function. So on your blood work, there'll be a reference for EGFR, okay? There is a EGFR African American, and then there is an EGFR non-African American. And what that does is it shows you how well your kidneys are working. Your kidneys are your primary filtration for heavy metal toxicity. And so if you get to that point where your kidneys are not working properly, then you've lost some of your immune defense, so that the heavy metals are going to provide a basis, an environment for pathogens to grow, okay? So we don't want that. What we want is the immune system, the innate immune system working the way it needs to be, and we want the acquired immune system working the way it needs to be. In order not to overwhelm that, we need to stop putting into our body things that don't need to go into our body. Now, none of us that I know that are watching me today live in the Garden of Eden. all right? So we all are dealing with environmental toxins all the time. And that's okay, because the body has the systems in place to deal with it. You've got your bowels that are going to move things out. You've got your liver that's going to filter the blood. You've got your lymph system that's going to do what it needs to do. However, if those things get backed up, then it's going to have an effect on your immune system. So there are a lot of things that you can do holistically with lifestyle changes, making sure that you walk, making sure that you breathe deeply, making sure that the food that you eat is good food, and making sure that you're not ingesting these contaminants. Now, again, we're going to just tell you this: if you are over 60, the flu shot, the pneumonia shot are not beneficial to you at all. And this is from the World Health Organization. This is not just Dr. Polly saying this. This is not Dr. Google saying this. These are people who know what they're talking about. So you need to really, really do your research and see what's going on with that. We've got an older lady. I mean, she's not ancient. She's a little bit older than I am, but her PCP was wanting her to get the flu shot and the pneumonia shot, and sure enough, she did. And she's definitely over, I think she's over 65. And she's never been so sick as she has been since she got the flu shot. So what else is in the flu shot? Well, you've got the thimerosal. What is the thimerosal? The thimerosal is a mercury. What does mercury do? Mercury kills the dendritic cells so that they're not able to recognize that pattern receptor so that it can fight your immune system. So probably I've given you enough information on that. You need to go clean out your cupboards. You need to look at your lifestyle. You need to make sure when you're driving in traffic that you don't have the vents open, because you don't want to be taking into your vehicle all of the exhaust from the other vehicles that are on the road with you, especially if you're in a traffic jam and that kind of thing. You want to make sure that if you work, we've got some really noxious places to work here in the Houston area. I mean, it is the smell of money for sure. And we're talking about the chemical plants, the oil plants, the gas plants, all that kind of stuff. But they are emitting toxic substances. And so we want to make sure that if we're in those areas, we've got our filters filtering properly so that we can do what we need to do. So I promised I was going to tell you some hope. Now, just so you know, we deal with ALS all the time. We deal with rheumatoid arthritis all the time. We deal with Hashimoto's all the time. We deal with autoimmune. We deal with Sjogren's. We deal with lupus. We deal with multiple sclerosis. We deal with all of that. The name doesn't matter, because at the bottom of when you get right down to it, it is an immune system that is compromised. So if we get the immune system uncompromised, then the immune system knows what it needs to do. So one of the products that we have, and it's a brand new product, and I love this product, and we're having great success with this, is called Spleen LF. So you can get this from us. You can't get this on the internet. It is a practitioner only. But what it does is it actually rebuilds your spleen. Now, just to review, the spleen is the largest organ in the lymphatic system. Its primary role is to filter the blood of the damaged cells, the cellular debris, the pathogens, such as bacteria and viruses. It's also a storehouse of red blood cells and platelets. The spleen consists of two types of tissue, your red pulp and your white pulp. Now, I will just tell you that this particular product goes in and it rebuilds the spleen, it rebuilds the bone marrow, it rebuilds your red blood cells, your white blood cells. So if you've got a blood disorder, this is a great product for you. It gives you energy. It helps your blood to be good. We had a lady that came in this morning, and she's got an autoimmune platelet disorder. And we've had her on this product, and her platelets had a great resolution. They're still a little bit out of kilter, but they're coming into range. She's been on this product about 60 days. At a low dose, we kind of went up on the dose today because we're having such good results on that. But we want to make sure that if you've got any kind of blood disorder or autoimmune disorder, we want to make sure that you get this because this is really, really good. It rebuilds your lymph tissue. You know, your your bone marrow produces all of your blood cells. And so if you've got red blood cell disorder, if you've got white blood cell disorder, if you've got bone marrow disorder, this is a great product for you, and it's very, very good. It also, this product has adaptogenic herbs. Now, adaptogenic herbs work by re-regulating two master control systems in the body, okay? So what that means is it just helps everything work the way it needs to work. And so this is a great, great foundational product. It's probably not the only product that you need, but if you have an autoimmune condition, this is certainly a product that you need. We've got other products here in the clinic that we test. We test you to see if you've got heavy metal toxicity, see if you've got chemical toxicity, see if you've got viruses, bacteria, or whatnot. We've got products that go and help the body eradicate these things, and then we rebuild the body so that the immune system can be restored to its natural state and that you can restore your health. So I've given you a lot of information, okay? I'm sure you have some questions. Reach out. We'll try to answer those. We have another product that's called Thymus LF, and it rebuilds your immune system too. And it's a very, very good product, but when you've got autoimmune issues, the spleen LF is just the best thing that you can do. You can do both of them if you want to. I kind of go around and do these things from time to time just because I want to make sure that my immune system stays intact and I'm able to get everything that I need. And no, I do not take the flu shot. And no, I do not take the pneumonia shot. And no, I do not take the shingle shot. And no, I do not recommend that you give your teenage kids the HPV vaccine. Just throwing all that out there. There are a lot of things that are not good about those shots. They've got, like I say, they've got formaldehyde, they've got thimerosal, they've got aborted fetal cells, they've got the simian 40 virus. Not every vaccine has every one of those, but every vaccine has something that's noxious in it. And so we don't want to be putting that into our skin because why? Because the skin is part of our innate immune system and it protects us from those things. We were never meant to be injected with the things that we are being injected in. So I'm going to pause because I've given you a lot of information. We'll talk more about autoimmune disease next week. And hopefully, if you have a specific autoimmune disease you want me to cover, I'll be able to do that. But at the bottom of the tree, the root issue is your immune system is not working. Okay, your immune system is not working. So what we want to do is we want to help you with that. So reach out, let me know what you want to know about autoimmune disease, especially if it works with you. There are all kinds of medications that people are on for autoimmune diseases, and they have varying stages of success. It depends on how your body is able to cope with that. So not necessarily discounting that, but my specialty is in holistic methods, so that's what we'll be talking about. So it is Friday. I don't know if you guys are like I am, but it's been a short week. A short week is hard because you're cramming 5 days worth of work into 4 days, and it just makes me tired at the end of the day. So you guys have a great weekend, recover, rest, and I will see you next week. Take care. Love you guys. Bye-bye.